Or Chicago Public Schools is going beyond what the CDC is saying, and it will require masks for everyone, even if they are vaccinated. Infectious disease expert Dr. Robert Citrenberg from Advocate Aurora Health is with us live this morning. Doctor, good morning.
Morning, Terrell.
And the CDC is not making this recommendation, or at least hasn't yet. Why not?
I think they're leaving it to the judgment of individual school districts or jurisdictions to decide about masks in schools. The fact is, if the teachers are vaccinated, the parents are vaccinated, there's actually probably very little risk to having kids unmasked in schools. But I think the statement that CPS is making is we want to take no chances about spread of disease because we must have in-person learning. It's almost like the belt and suspenders approach, which I can't really argue with. It may be a little bit of overkill, but it's a sensible plan if you want to do everything possible to make sure kids have in-person learning.
CNN is reporting new discussions at the White House about whether to tell vaccinated Americans to go back to wearing masks. Do you think that's advisable?
No, Tanya, I don't think there will be any sort of federal mandate about masks for the vaccinated. Masking protects the unvaccinated, but not nearly as well as getting those people vaccinated. I think a lot of the reason why people get vaccinated, it's an incentive so they don't have to wear masks. They choose not to. So it would be a very little benefit overall. It would create a lot of frustration and ill will among people who've already been vaccinated. All the efforts, instead of having any sort of mask mandates, should be efforts, massive efforts to get the unvaccinated, to get them vaccinated.
And while we're talking about that, doctor, as we look at the numbers in Illinois' test positivity rate, it's jumped from 3% to 3.3%. That's the biggest one-day increase since January. At the same time, though, a lot more people have been vaccinated since January. Any idea why this is happening?
Yeah, well, even though many more people have been vaccinated, not enough have. There's still too many unvaccinated people that will allow these numbers to go up. Now, you have to be careful because when we look at the total test positivity, it includes everybody, people with no symptoms, mild symptoms, and severe illness. I think the numbers really to focus on are the numbers of hospitalizations and numbers of deaths, more so than the total numbers of cases or total positivity rate. So as long as we have a large number of unvaccinated people in our community, that positivity rate may go up, but we just want to make sure it doesn't translate into increased hospitalizations and increased deaths.
And Dr. Citrenberg, can you give us some perspective on how this is happening regionally? Because the positivity rate in Chicago is still relatively low. It's below 2%, but then you get the positivity rate out in the St. Louis area, and that's much higher, closer to 88%.
Yeah, you have a lot of regional variation, even sometimes from county to county, and it's mostly based on the vaccination rate in those particular areas. We know we give an overall positivity rate for the state, but just county to county, it differs a lot. And what we're seeing around the country, we saw it in Southwest Missouri, in Florida, Arkansas. These little mini surges, high positivity rates are tending to occur in populations with low vaccination rates, but there is a lot of variability from county to county.
Dr. Robert Citrenberg, Advocate Aurora Health.
That's right. Thank you, sir.
Appreciate it.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.